Okay, I think we'll start. I think people will join later on, so we'll start. But let me just introduce a speaker. But before then, you are all welcome to this evening's talk, today's talk series. The topic really is on mental health and dementia. Mental health is something that really affects a lot of the elderly, a lot of people. I think somebody said we all are affected by mental health in different in different shades. But Samuel Hanson would be talking on this topic. Samuel Hanson went to DSTS from 1983 to 88. He was in our 7. He wasn't an athlete, right? But, no. Yes, very popular, very, very popular guy. So, and at the moment, he is a consultant, social worker at the London Borough of Barking and Dagenham. And he's been there for more than 10 years, I think. Yes. So he's got a lot of experience. And very, very early on, in fact, the beginning of the year, he said, I want to speak on this topic. So he put his name down very, very early on. And today is the day that, yes, he's got an opportunity to speak to us. So over to you, Samuel Hanson.
Thank you very much. So I'm going to start my presentation. Actually, the topic of this presentation is on mental health and dementia awareness. I did master's in social work, and I'm also approved mental health practitioner, and I'm also a best interest assessor because I undertake a lot of mental capacity assessment, and because of the kind of job that I do, I'm involved with the legal system. So I happen to send a lot of report to the Court of Protection and to the Magistrate Court. And when we say Court of Protection in the United Kingdom, it's a higher court. And I'm also involved with County Court, Crown Court. We have different types of courts. We have higher court and lower court. But then because of the kind of profession that I'm in, I always have to present reports, which is very, very interesting. So today, the reason why I decided to talk about this is because there's a lot of people, as Ray had said before, there's a lot of people living with some form of mental ill health without even having an aware of that. And when I used to live in my home country in Ghana, all that I knew about mental health was someone who is really, really mad, stripped naked, walking on the street. But then being in this part of the world for nearly 30 years, I have come to realize that there are so many people who live with different forms of mental illness, but then they are able to engage in meaningful activities. They are able to hold jobs. And some people too, they live with mental illness, they are unable to hold jobs. So there are many definitions of mental health, but then I went by the definition that is coined by the World Health Organization, which I believe is a big organization that is well known to the whole world. So because we have a definition from Royal College of Psychiatry in the United Kingdom, we have definition from Harvard, we have definition from everywhere, but then I decided purposely to go by the definition coined by the World Health Organization. So mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make contribution to his or her community. So this is a definition that has been accepted by the World Health Organization. And apart from that, We have positive mental health and a negative mental health. When we talk about positive mental health, it refers to the presence of positive emotions and good functioning in both individual and your social environment. Work being done by Corey Keynes at Emory University has shown that individuals with high Ray, this is covering my presentation. Yes, it's all right. Individuals with high positive mental health are less likely to develop depression and chronic disease. And also, we have a negative mental health. Negative mental health refers to people who experiences negative thought now and again, negative thinking that seriously affect the way you think about yourself and the world, and even interferes with work, study, everyday functioning. They are symptoms of negative mental health. So there are people that their mental health is so severe that they can't engage in any meaningful conversation, meaningful activities. They can't engage in work. They can't engage in education. So that is termed as a negative mental health. And those with positive mental health are people that they live with the illness, but still they are either being controlled by education, or I wouldn't say controlled, they are being supported by education, and they are able to engage in meaningful activities, work, and even they are able to engage in relationships, in marriages, and all kind of things. And so now I'm going to talk about types of mental illness, types of mental illness. The most common one is anxiety. And anxiety is what we feel when we are worried, tense, or afraid, particularly about things that are about to happen or which we could think could happen in the future. And anxiety happens to so many people in the community, even especially some married men who are very unstable, or married women who are very unstable, when they see that probably their spouse or other half has got friends, and they feel that they are engaged in a relationship with them, and from there they start becoming anxious, and from anxious it progresses to paranoia and all sort of things. So anxiety itself is some form of mental health, but then we have some form of mental health that is being dealt with by primary care. That is when you see your GP. In the United Kingdom, every area have their own general practice, and it's the same thing in North America. Every area have their community doctor. I've seen that in Canada, but I believe it's the same thing in North America. But then in the part of the world we come from, we don't have a setting like that apart from accessing the general hospital. And also another form of mental illness is panic attacks. And panic attacks are a type of fear response. They are exaggerations of your body's normal response to danger, stress, or excitement. Normally, people with panic attacks, someone might ask, what do panic attacks feel like? Like when you have a pounding or racing heartbeat, it's a form of panic attack. When you are feeling faint, dizzy, lightheaded, it's a form of panic attacks. When you are feeling very hot or very cold, it could be some of the symptoms as well. And some people, when they experience panic attacks, you see that they start shaking, their palms start sweating, trembling, and they have shaking voices. It's a form of panic attacks. And some people to become news are feeling very, very sick. At times, some people happen to throw up and vomit and all kind of things. Some people happen to have a pain chest or abdominal pain. pain in the chest or in the abdomen. Some people struggle to breathe, feeling like they are choking. And some people feel like their legs are being shaken or turning into jelly. And at times, some people feel disconnected from their mind, from their body. It's also some form of panic attack. It's part of the symptoms of panic attack. So it's also some form of mental illness. Then from there, we will come to depression, which we all know about depression. And the depression is a low mood that lasts for a long time and affects everyday life. For example, in its mildest form, depression can mean just being in low spirit. It doesn't stop you leading your normal life, but makes everything harder to do and seem less worthwhile. And at its most severe, the depression can be life-threatening because it can make you feel suicidal. So when we talk about the domain of mental health, it's very, very broad, but it's got pockets of mental health. Then from there, we have another one called bipolar disorder. Bipolar disorder is a mental health problem that mainly affects your mood. If you have bipolar disorder, you are likely to have times where you experience manic or hypomanic episode, meaning there are times you feel very, very high. There are times where you experience depressive episodes, feeling very, very low. And the reason why is like even people in our workplaces, there are some people that there are times when they say, hello, you're right, you're keeping well, and they are very, very high. They can engage you in conversation over and over for a long period of time. There are times when they see you, they ignore you. Before I didn't understand. I said that even especially when I started working in offices, at times there are some people you sit with them in the office, they talk to you very nice, everything is fine. But when they see you outside, then they just lift their head away. They behave like they don't even know you. So you have to know that that is some form of bipolar disorder. When they are fine, at times they will be nice with you in the office environment. When they meet you outside, they can talk to you, start telling you about their life and everything, whatever they did at weekends. But when they are low, they see you, they will blank you, ignore you. And as a rational human being, you start thinking, what is going wrong? But before, I always say that if I'm in the field of IT, I wouldn't have known about this. But being in the field that I work now has given me a true understanding of the system that I live in. And people with bipolar, potentially, they do experience some psychotic symptoms during manic or depressed episode. Some of them, those who are known to secondary mental health. I mean, when I talk about secondary mental health, I'm referring to those who have a formal diagnosis and they have a responsible clinician, meaning a psychiatry consultant involved in their lives. They tend to see them on a quarterly basis to review their medication. Some of them too, they've read about the condition. So when they are high, they know. When they are low, they know. Some can have suicidal tendencies, and as soon as they start feeling that, they will contact a loved one. Could you speak to my consultant? I want to have a medication review. I want to have someone to chat with. But the most serious and the dangerous ones are those who live with that condition, don't have anyone. When you live with that condition and you don't have anyone around you and you don't have an insight, meaning awareness of that, like some people, what I like about this part of the world, some people have been diagnosed with mental health, bipolar disorder. They will look for information and read. So when they are up, they know. When they are middle, they know. When they are low, they know. When they have to seek medical intervention, they know. And some people don't leave it to get to the last minute of relapse. that get to the worst point before they seek help. Then we have body dysmorphic disorder. It's an anxiety disorder related to body image. For example, obsessive worries about one or more perceived flaws in your physical appearance, and the flaws cannot be seen by others or appears very, very slight. In addition, people can develop compulsive behaviors and routine, such as excessive use of mirrors or picking their skin to deal with the worries they have and the way they look. This normally happens to women. It also happens to men as well, but not all men, especially women. There are some women, when you live with them, they will look in the mirror more than 10 times, 12 times a day. As soon as you live with a woman who happens to do that, you should be mindful that something is not right, because all the time they have to look at their face, make sure they've got their lipstick on, their eyebrow, this. And some women who are attention seekers would come to the boyfriend or the husband, do I look right? You say that, oh, you look perfect. And within a short time, they will come again. There are times that they will say that, oh, they think they have it, but you cannot see it, you cannot observe it. So it's also some form of mental ill health. Then we have the most dangerous one is it's among of the most dangerous one, borderline personality disorder, and clinically it's also called unemotional. It's also called emotional unstable personality disorder. According to the clinicians, when I say clinicians, I'm referring to the psychiatry consultant. People have different views of borderline personality disorder or emotional unstable personality disorder. It can be very controversial diagnosis. Example, you feel worried about people abandoning you and would do anything to stop that happening. You have very intense emotion that lasts from a few hours to a few days and can change quickly. For example, feeling very happy and confident to suddenly feel low and sad. And from practice, what I've seen with people with this condition, I don't know, but then during summertime, when you see white people that you see their arms with a lot of scratch marks, a cut, people with personality disorder, there are times when they feel that they have to cut themselves, they will cut with a real knife or blade. They will cut and cut and cut and cut until they feel that they are very, very okay. They see blood flowing everywhere. Then they become satisfied. People with borderline personality disorder, when you send money to them in Africa, if the money you sent, probably you sent about $10 to them, $20 or to £20, they won't even say thank you. But however, if you send them £100, 200, 300, they will call and say thank you. They have a PD because as a rational human, every little thing you have to show an appreciation. And also people with PD, you don't have a strong sense of who you are, and they can change significantly depending upon who they are. Or also they find it very hard to make and keep a stable relationship. There are some men or there are some women who tend to jump from a relationship to a relationship to a relationship to a relationship, and people might feel it's normal. It's not normal. It's a form of borderline personality disorder, because as a rational human being, you'll be in a relationship with someone. Studies has proven that at least up to 6 months, a year, then if it's not working, you leave. But then they can go into a relationship for about a few days, about a week, and they switch and they move into another relationship for another few weeks, and they switch. And I see that all the time happening. And also they always feel empty a lot, or most of the time, and they act impulsively and do things that could harm you. And some of them, what they do is they will binge with alcohol, they will take excessive drugs, they will take an overdose. Like there was a case that we carried out a mental health assessment. There were 4 clinicians, all of them are consultants. And then at the time I was there, and the person gave us the answers we wanted to hear. She ticked all the boxes, everything you asked, she gave an answer. So because of that, the person did not meet the threshold to be detained in the psychiatric hospital under the mental health act to receive assessment and treatment. And again, what had happened was, as professionals, we wanted to arrange transport for her to go home. She said, "Oh, don't worry, I'm fine. I know, I want to take a bit of walk and I will get home safely," and blah, blah, blah. And we left this person. Guess what happened? Not knowing, the person knew when the next train was coming to pass through a station called Good Mace. So the person went there and got there exactly on time. And when the train passed, the person jumped, and unfortunately, the train cut off her head. Gone. That is people with borderline personality disorder. Some of them, from practice, some can take high doses of medication, but before they will do that, probably they will contact a psychiatric nurse, or if they have a social worker, they will tell them that this is what I intend to do. And by the time you see them, they've taken 40 tablets of paracetamol or ibuprofen. People with borderline personality disorder, they are very unpredictable. So when we know someone exhibiting those signs, we should help them. And also, the most severe form of mental illness is people who are schizophrenia. We might say someone is hearing voices. If you hear a voice when no one is present with you, or which other people with you cannot hear. And also, it is a long-term mental health condition. But research shows that a lot of people hear voices, and many of them are not mentally unwell. Yeah, because like now we have different religious group, and some of them can say they've heard a voice, and this is what God is saying. You and I, we couldn't hear. Only them are hearing. So that doesn't mean that doesn't mean it's negative. Probably it's true, but however, people with schizophrenia, they're dangerous parties. Some of them have delusions, hallucinations, disorganized speech, disorganized behavior, and they always feel that they are on top of the world. And there are times, a typical example, they will say that they hear someone call their name, but then there's no one with them. At times they can say that they hear or see things as they are falling asleep. And at times you can be with them, and they will tell you, have a look at this, look, but then they can see, you can see. And also, when people happen to live with this kind of mental illness, most of them affiliated with God. Most of them says they speak to Jesus, they speak to angels, they hear this and they hear this, they hear this. There's this woman I assessed her, and under them entered that with 2 consultants. And I believe that she realized that with my accent that I come from Ghana, then she started saying that what she can see, I can see, and she started speaking in our language that yes, she is there, she's a prophetess. I said, yeah, I do believe that, but do you believe that you live with mental illness? She's saying no. But I said, but you were going to jump from the 4th floor to the ground floor. That tells you are really unwell. There are times you experience situations, then she said, I come from her country, so why is it that I want to put her in a psychiatry ward? I said, I'm very sorry. Your presentation is clear evidence you are really unwell and you need to stay here up to 28 days for assessment and treatment. So you are detained under the entire attack. And also, people with schizophrenia, there are times they hear voices that they should harm people outside. And that is the most dangerous form of mental illness. But then they are being supported by medication. The condition can become very, very worse, when they do not take their medication. But then they can exhibit very, very weird and very, very strange behavior. There are times they hear a voice that feels friendly, but encourages them to do things that might not be good for you. I remember there's this white guy I saw some time ago, and when he met me, he said, "Oh, Samuel, I'm hearing a voice that I should harm somebody today." Then I said, "Oh, so the voice is telling you to harm me." He said, "No, I ain't gonna harm you, man. I'm gonna harm you, Samuel. You're a nice fella, you know what I mean? I ain't gonna harm you." Then I said, "So why is it that you want to harm somebody for?" He said, "No, the voices are seriously telling me to harm somebody. So as soon as you leave here, I'm going to take my knife and I'll be out there." So I said, "Oh, okay," because if you are in their home premises and they tell you things like this, you just have to accept it and calm them down. Then I said that, okay, I know that this is what you intend to do, but if you can give me half an hour, I want to pick something from my car. And as soon as I went to my car, I called the police and this and this. So I came there and said that, "Sam, but you entered there for a while." I said, no, because what I was looking for, I couldn't find it. So whilst we were there, the police came and straight they put handcuff and they took him to a psychiatry hospital. They said that, "Sam, you set me up." I said, "I never set you up, but for some reason you're unwell and you have to be in the hospital." Yes, because if I didn't act and this person had gone out there and killed someone, it means I have failed my duty of care. And in this part of the world, it's going to come to the TV. Yes, even the manager from social services was there. He saw this guy, he saw his presentation, he had a conversation with him, and he didn't do anything to save the condition. Okay, then now I just have a few, then all done. Then if any question you can ask. Dementia. Dementia is an umbrella term for a range of progressive conditions that affect the human brain. There are 4 most common types of dementia, which I believe probably a lot of us on this platform are aware. Alzheimer's disease, we have vascular dementia, we have frontotemporal dementia, and Lewy bodies dementia. But dementia can affect a person at any age, but it is more commonly diagnosed in people over the age of 65 years. But then again, we have an early onset of dementia as well. So a person developing dementia before the age of 65 is said to have a young onset dementia. It is possible to have not just one, but 2 types of dementia at the same time. The most common is the combination of Alzheimer's and vascular dementia, and they are known as a mixed dementia. So if somebody lives with Alzheimer's and lives with vascular, they are called a mixed dementia. And symptoms of dementia. People with dementia might have problems retaining new information. They might get lost in previously familiar places and may struggle with names. Relatives might notice the person seems increasingly forgetful, misplacing things regularly. People with dementia may have problems with their concentration level, which also can impact on their short-term memory. They may have difficulty with time and place. For example, getting up in the middle of the night to go to work, even though they are retired. When I used to work for Tarok, adult social services, dementia team, there was a time this older man at the age of 85 at midnight was on his mobility scooter, because people with dementia, some of them sees midnight as a broad daylight. So the person was on the A13 and was picked by the police, because when they saw that it wasn't normal, because at that time of the night, and also there was a time somebody was picked in Hornchurch. The person thought it was a daytime and it was 1 a.m. an older person. So the person was also picked by the police, and the person was taken to Queen's Hospital and came to our notice on Monday. We assessed the person and we found that the person was unsafe to stay at home. And a lot of people, it's not very comfortable. A lot of people don't want to live in a residential care home 24 hours because they've lived their own lives and they feel that still they can continue to stay at home. But then at times, situation might not permit you. And when someone is in such situation, that person has to be cared for in a 24-hour setting. And we have frontotemporal and Lewy bodies. Frontotemporal dementia is a progressive condition, which means that the symptoms worsen over time. This tend to affect people age 45 toward 65. So the early onset, but by even some can be even as young as 20 years. It's very, very sad. And males and females are in equal measure. And dementia with Lewy bodies is also a progressive condition, which means that the symptoms worsen over time. It affects movement, motor control, meaning your brain, and a person with a dementia with Lewy bodies, they might be prone to falls. They might have tremors similar to Parkinson's. There are times they have their hands shaking and all sort of things. And even some of them, when they speak, their mouth goes like, or some of them, when they are sitting quietly, they tend to do things like. And when we were back home, some people would attribute that to the older men or older women that they are witch and wizard, because we didn't even have that form of understanding, because at the time, knowledge was not global. But these days, anyone can seek for knowledge. You don't need a doctor alone to know some things. You can also know things as well. And even especially in the part of the world we come from, churches, most of the pastors, they tend to let older persons become victims and bring confusion between them and their sons and daughters in abroad, that your mom is witch, and even the daughter can say, oh, even I can see my mom saying names at night, or all that sort of thing. It's part of her condition. Things are not right. The cognition is gone. They've got cognitive impairment. So at times they can say things anyhow. That doesn't mean they are witch or is that. And also, at times they shuffle when they walk. They experience disrupted sleep patterns due to intense dreams or night wells. At times they can have visual and auditory hallucinations due to the nerve cell that is damaged. And the vascular one, I will touch base on Alzheimer's before vascular, but vascular dementia is the most common type of dementia in the United Kingdom. And it is a physical condition caused by changes in the structure of the brain. And this is due to a buildup of proteins resulting in plaques and tangles, which damage the brain cells and your ability to transmit messages, which eventually lead to deterioration in the brain cells. So that is the type of dementia called Alzheimer's. And we have vascular one. And the vascular one is the second most common type of dementia. It is caused by problems in the blood supply to the brain cells, commonly due to strokes or a series of small strokes, or known as transient ischemic attacks, which cause areas of localized cells damage in the brain. And the last one is alcohol-related brain damage. It's also some form of dementia. Alcohol-related brain damage, also known as alcohol-related brain impairment, is caused by drinking alcohol excessively over a prolonged period of time. And when that happens, you tend to have a Korsakoff syndrome, which occurs more gradually, and the symptoms are usually attention and concentration problems, gaps in memory, which are usually filled inaccurately, and you can have confabulation and a difficulty of learning new things. My auntie in this part of the world, she's lived there for more than 50 years. Unfortunately, she lives with that type of dementia because marriage didn't go well, and over the period of years after work, she would drink alcohol. And even now, when she sees me, she's unable to recognize me. We could sit and have a conversation for a period of time, and she will still not even notice that it's me. And she will ask, "Who are you?" It's gone. So if probably we consume high level of alcohol, especially in terms of spirit, we have to be very mindful. I know that we are all out, that it's just a piece of advice so that we might not cause damage to our brain, because the brain can start deteriorating from the age of 40, and we have to be mindful and careful. And this is a little bit of mental health and dementia awareness that me to being part of GSTS. I think that if I've been able to acquire a bit of knowledge, I should tell somebody, in order that if people around you or your network of friends or someone within your immediate nucleus family is experiencing things like this, then it might not be peculiar to you, but then you will know when to support that person to seek help before it gets to the point of deterioration. So thank you very much. So if there's any question, it's welcome. Thank you.
Thank you so much for your superb presentation, Hanson. You've done very well. So much info you've given to us this evening.
Yeah, but also, Ray, people have to be mindful on this platform that my name is Samuel Hanson. I'm not going through a transition because the Zoom is in my wife's name. So you will see Olivia Hanson, and some people might feel that how come they are seeing there? So I'm not going through a transition. I am still straight.
Yes. It's Samuel Hanson, not Olivia.
I'm Samuel Hanson. That's right.
Okay. Yes. So yes, you're open for questions. My first question is the medication that they give. Is it actually helpful?
Okay. Actually, it's not all types of mental illness that requires medication. Some just need talking therapy, like open dialogue. Some need cognitive behavior therapy. But from experience, one thing I've seen in this part of the world is the clinicians, when they see that you are a very difficult person, this one, I'm talking from things that I have seen. They can dose you with medication that will even worsen the problem. That is a fact. So, oh yes, I'm telling you the truth, because when they see that you are not working in partnership with them, then you have to be very careful. And as soon as they put you on psychotropic medication for you to reverse back to your normal life, I doubt very much that recovery is going to be possible.
Okay. Yeah. Doc?
Yeah. Why is it that what you said is very, very interesting. because sometimes just to get rid of people as a nuisance, they start piling them with drugs. I have an experience of that. A niece of mine came to live with me in Accra, and over a weekend, she belonged to one of these Pentecostal charismatic churches.
Mm.
She went to an overnight, what they call an all-night service.
All night, yeah, that's right.
Came back on Monday morning, and she said she was married to Jesus.
Mm.
And for the next week, it was, in fact, for the next 2 days, it was really serious. And the third night, fortunately, I had a nephew staying with us. So we literally had to restrain her, push her in the car and take her to, because I got out at one point, I got out of the room. I have a long driveway.
Mm.
She was stuck naked, trying to climb up the gate. I got there just in time, pulled her, and so we pushed her in a car and took her to 37. Sorry, the mental hospital in Accra. She was there for about 3 weeks, and she was okay. But I have another niece who is a clinical psychologist at 37, who deals with very different cases. So I took her to see her. She saw her on 3 occasions, and she said, "Uncle," she didn't need any medication. The medication would get it worse. But instead, she spoke to her, she talked to her and got her confidence. And eventually, what she said was, "Uncle, it's just a mental problem." She feels she feels that she has failed in life because at 32, nearly 32, she didn't have a husband, she didn't have a boyfriend, she didn't have a child, and she was living with her uncle. So that was the problem. So if you can, so after speaking to her, she became fine. She said, what you need to do is get her a place of her own, rent a place for her. And that's it. That was what I did. And immediately she was all right. But my niece said if she had continued with the medication, it would have been a lot worse. But apparently in Ghana, because sometimes they think it's a nuisance. So as soon as you go there, you get there, they start piling you with medication. And that usually worsens the situation. That's why I was interested in what you said.
Yeah, yes, because doctor, what happens is when, because in the case of your niece, it was first episode, and being a first episode of that form of whatever had happened to her did not require a medication. However, like in that instance, and again, you had said she attended an all night, so probably she didn't have no sleep, and probably there were things that were said that probably she could not disclose it to you. So there were so many things compounding on her mind at the time. So that triggered. So based on that, I think the best action you did was she needed a talking therapy.
Yeah.
And that resolved the crisis.
Thank you.
You're welcome. And Dr. Habakwe is on the line. Yes, Doc. Let's hear you.
Hello. Good afternoon, and thank you for this very interesting talk. I have a question, and that relates to GSDS. This morning, I've been dealing with one of our giants who I believe when it was at GSDS kind of used drugs and now has some mental issues. My question is, what can we do now to stop these things at the campus? Because apparently, according to him, there are a lot of them like that who very brilliant students, but used drugs while they were at GSDS. and now have serious mental issues. So I'm kind of thinking, as the Alumni Association, or in your experience, do you deal with schools, and what kind of interventions can we put in before they become problems to deal with later? Thanks.
Yeah, you're welcome, Doc. The Doc. Based on what you have said, it appears that person's form of mental illness is drug-induced, is drug-related, and Doc, I will use myself as an example, which I believe Ray will be a witness, because Ray was my mate from 1 to Form 5. I used to smoke a lot of weed. Oh yes, I used to smoke, but I thank God that and after GC O levels, because when we were in school, they had promised that as soon as I complete O levels, I'm coming to England to do A levels here, go to university and all kind of things. So just after that, because that didn't happen, even I was smoking more. I was smoking more and more because all my mates like Ray, they were in sixth form, and people had even progressed to sixth form to university, and still I didn't know what was happening. And I said, for me, if I don't come to this part of the world, I wasn't going to do anything until I came here. But I came here, and upon point of reflection, I saw that I was still a bit younger and I could go to school. So relating to the question you asked, if there's drug and alcohol service, that would be the first point of intervention. I don't know if they have some in Ghana. Even if I believe they have some there, but probably it might be a private sector, and probably they will charge a lot of money. So when that person assess that service, they will assign a quarterly program to that person that might last for 3 months, and that person should be willing to work in partnership with the professionals involved, because Doc, the difficulty is when people come into the point of acceptance that I need help, it's very easy to work with them. But then some people may say they need help, but you put help in place and they will not access the service. So when that happens, that one is very difficult to get that answers that you need. So also, if the person can have a bit of talking therapy, mental health awareness, letting the person know, Doc, from now, what I know, nobody can tell me that weed does not contribute to psychosis. Weed is the major form of contribution to psychosis, because even when we were in school, Form 5, anytime I smoked weed, I saw my mates, I saw them like an ant. I thought I knew. Oh yes, I thought I knew more than them, and all the time you said that yes, I'm going to come to Babylon, I'll be a millionaire, and all kind of having delusional talks and all kind of things. And also some people might see, oh, Dr. Habakweda, oh, he was my mate, now he's moved on, and now I've not been able to do anything for myself. So even for them to move on from that point, the inception point itself is very difficult. But then if there's any services like that, that would be good. So they might need a talking therapy, and probably a bit of education will help, not too much education, but then they have to make up their mind that they are prepared to stop taking that, because if people are accessing services and still taking illicit substances, it won't help.
Mm-hmm. But my question is, right now, whilst they are at school, you know, when we're at school, those who use drugs would not, own up. And they would still be using the drugs. By the time they graduate, it's already a habit, and it's kind of, very little can be done. Can we set up a system where, whilst they're at school, maybe confidentially they can meet drug therapists or something like that?
It can be done.
Because I think by the time they graduate, it's over. It's late.
It can be done. That is a very good initiative, and also and if that is set up, and probably they can have someone who can give an open talk to, that would be very helpful. I don't mind. The next time I'm going to Ghana, he's going to be in March to give a talk, because it's something seriously on my heart to let people know, using myself as a phenomenology, someone with a lived experience, because I have been there. So therefore, let people know that them using illicit substances whilst they are in school will never help them anyway. And I will use myself as a strong example and tell people that the chairman of GAA, who lives in North America, is part of his plan for us to set some form of a team that people who needs that help should come forward, and we will help them. Because else, if they don't access that help from whilst they are in the secondary school, when they go out in the world, it's going to be worse.
Right. Yeah. Thank you. I'll talk to you about it later.
Yeah.
Thank you, Doctor. Thank you.
Yeah. Because I think if the school authorities know that you take drugs, it's dismissal.
I know, right?
Forfeit, isn't it? Yeah.
Yeah, but it shouldn't be so. I mean, it's we can talk people. People can get rehabilitated. Yeah.
Yes. And also, Doctor, I think that even especially the GSS alumni, those in Ghana and in this part of the world, we have to let the head teacher know that, we acknowledge that this problem is there, and therefore, when people even come out, they shouldn't be stigmatized. It's not like in our days that, even I believe that in our days, if some people who knew that I used to smoke it, I remember when I met my wife, they said, "Hey, are you not scared of this guy? This guy who used to smoke weed and but they don't know that people go through a point of transformation in their life, because the only permanent thing in life is change, and change comes with respect to time. So people don't acknowledge the fact that people can change, because then we should let the headmaster now know that when people come forward, they shouldn't be stigmatized, and also they shouldn't tell the whole school that this is the kind of world that they are in, because if even one person is identified, that person will be able to bring some other people. Because I remember in our days, I knew everyone who smoked weed in GSTS. Oh yes. Yeah. It wasn't an achievement. I don't even know how oh yes, I am not proud of it, and I don't even know how I got in there, but now, upon reflection, I always say that if I knew what I know now, I would never have done that. But for me, I have been evolved and I've come out, and I'm very happy.
And Sonic.
I think Doctor has another question, I believe. Doctor.
Yes. What somebody has posted that it has to start from the primary school, and that is true. In my sixth form class, we had two guys who came from Accra Academy who joined us. One came from Domain Crow Secondary School, and one came from Accra Academy. There were three of them from Accra Academy, but two of them and another young man who was in Form 5, Lai, brilliant boy. But they got into that, and by the time I went back to Ghana in '84, one day I was driving and I saw Lai walking stark naked on Independence Avenue. So I called the late Togi Poku. I said, I saw somebody like Lai. I said, oh yeah, he's raving mad. He said they were in the same house. They were smoking. We were telling them they didn't bother. One of the guys, the guy from Accra Academy, he also went raving mad. And then there was this guy from the Mahinkro. Can you believe that he will walk from Accra? Apparently, he lived somewhere around Dansuman. He will walk from Accra to my office. He heard that I was at GMPC. He walked from Accra to my office at GMPC. He did it twice. I gave him money to take transport. I tried to get him a taxi. apparently after I turned around, the security people came to tell me that he dismissed the taxi and decided to walk back to Accra. So I think it is something that we need to take very seriously in our schools, because it looks like, in fact, at GSTS, even in those days, that time when everything was so strict, it was still, some people still did it. And invariably, they got into very, very serious trouble. So if we can have some kind of arrangement where there'll be lectures, maybe annual lectures or something like that, perhaps the GAA can get involved in that, because it's destructive and it's dangerous. Thank you.
Yeah, and also, Doctor, in addition, people who live in the world of or people who have taken weed and all kind of things, when they see people who don't live in that world, they see them like they don't know anything. Because
yes,
I remember there's this white chap we assessed him, and he said, Sam, like, you get me, you know what I mean? Yeah, like, you know, you don't get it, Sam, you don't get it, you know what I mean? Like, how I feel, yeah, you don't get it because you, Sam, you haven't seen what I've seen. But then I laughed in my head. Then I said that if you knew where I'm coming from, like, you would tell me that I don't get it. You anyway. So yeah. Then he said, Sam, have you smoked ciggy before? I said, no. Weed. I said, no. I said, no, you don't know what time it is. You know what I mean? I thought you know how far. And I said, somebody that I have had that belt over 20 years of my life, a little boy of 22 telling me I don't know how far. Because yes, but because of the job I do and confidentiality, you couldn't use yourself to even talk to him that, hey, listen, boy, I used to live in this kind of world before. Do you get me? That will help me. Yeah. So.
Oh dear.
Let me ask you a question. If you don't mind, did you start at GSTS or before GSTS?
Doc, I started at GSTS not from Form 2, one of the seniors, but I won't mention his name because of confidentiality. Yes, so one of the seniors who was in, I will mention the house, the Dodo house.
Okay.
Yes, saw me and said that you officials here be rebel, you know, and I said, yeah. Then he said, for me them down there. There is another secondary school they used to have this circle. Yeah. And they have, yeah, so that is where we met, and that was my first trial. And after that, I liked it. Yeah. Yeah, so I'm telling you, Doc, you see, and at times, this guy was consistently, because now I was in the ring. So if I didn't continue, he would bully me anyway. So I had to. So I was into Form 5, and after Form 5, graduated, you know, from there. And it's not very nice experience. Not very nice. So it starts from the campus, because there are some people who are in that world who identify the vulnerable ones and start engineering them, educating them.
Right.
Then, so there were many of us.
Okay.
And it's not good, because we were in that institution to pursue education and to become good citizens and make impact in the lives of humans.
Yeah.
I've been talking to one morning, and it seems to be a big problem. So,
like your brain not computer, you are fast. You are fast.
So somebody Felix Amase is very interested in the subject. It's close to his heart.
You're thinking, okay, you get us. You're thinking.
Yeah.
You think about so many.
What about eating disorders? Is also mental health or not?
Yes. Yes. But then that sits under mental health and learning disability.
Okay.
Yeah.
Okay.
Hey, Professor is here. Professor Sanka is here. Welcome, sir.
Oh, thank you. Hansonic, great discussion. I'm loving the personal experiences.
Yeah, but I always say that it wasn't an achievement and it wasn't a nice thing, but coming to the point of realization, I have seen that I have been fortunate, because I always say that if I still probably lived in Ghana and didn't have a chance of being in this part of the world, probably I would have been among the people stripping naked, walking on the street, because I would have seen at the time that life didn't have anything to offer me, because all my mates, the good ones like Sanka, Boyson, Ray, all of them, either they are out of the country or they've been to university, having nice jobs and seeing myself as a failure. So, or probably I could have been dead, but I'm very fortunate.
Giant Amwa, 85. Do you want to add anything or any question?
Yeah, it's very complex. I mean, there are 16 psychiatrists in Ghana. Literally one psychiatrist to 1.5 million people.
Really?
There's a lot of components. There's the genetics, there's the religion, there's the poverty, the I don't know where to start, the lack of knowledge. When I was in Ghana, I had to order my medication from the UK. If I didn't have, the means, I'll be walking on the streets, just like we're talking about. So I don't know where to start. I know for sure that the genetic component we underplayed. I had an aunt who would be talking in the air and raising her hands, and we just thought, oh, auntie is a little bit cuckoo. And so we left her alone. Then I, at age, was it 29, I thought I'd discovered some big discoveries, and I was walking the streets in London. Then you start investigating it and you realize even my dad used to take Valium to sleep. So from a genetic perspective, it's already there.
Yeah,
and,
it's true.
Knowing that, then one can start thinking of therapies. But like cognitive behavior therapy, that's what we can do without worrying about the cost involved. And I think traditionally in our communities, we do have cognitive behavior therapy. We don't label it like that, but when things are going on and people are stressful, besides saying Anyashri, we sit down and we talk to the person, just like a senior boss saying, you sometimes you are lucky you have people who are patient and will listen to you and give you some advice. Sometimes you end up in a 37 or asylum, and you get to meet some psychologists who can work with you. But the knowledge knowing it could be different dimensions. The spiritual one, you do all night. You have positioned yourself in a state where you are agitated, and so it's very, very complex. But once we start the discussion, that's the important. And even at GSTS, if we can start the discussion, like doing some presentations like we are doing now, educating the teachers, that is a good start. That's a good start. But we have to realize, for example, depression. We say, oh, the person is lazy, the person is this, the person is that. but it's a clinical illness. And if you have 16 psychiatrists in the whole country, it's going to be difficult to get psychiatric help. And then if the medication is so expensive, it's going to be difficult to have psychiatric help. And if the diagnosis is not correct, that is huge, because if the diagnosis is not correct, they're going to be giving you a medication which is wrong, which is going to leave you in another direction. So that's huge. But once we start the dialogue, knowing that, look, this thing is mental health. Let's take, for example, if you had diabetes, you go and see the doctor. If you had high blood pressure, you go and see the doctor. If you have disease in your brain, you start attributing it to aunt, uncle, witch, whatever. But it's the same illness that you have in your head. There shouldn't be any stigma. The best way which it was defined for me, which made sense, was that if you have diabetes, if you have high blood pressure, if you are blind, if you have all this physical illness that we can see, when you go to the doctor, it's not a stigma. If you have injury in your head and you go to the doctor, it's a stigma. Like I'm talking now, I inherited some genes. My daughter has got ADHD, which is a mental health disorder. If you track it out, her uncle, my mother's side, her uncle, her father's side, have had mental health illness. Luckily, the part of the world we are is diagnosed and it can be controlled with medication. So even when we were getting married, we knew that with the background of mental illness that we're having from our mother, from my wife's side, and from my family side, there is possibility that our offspring would have an issue. However, having the resources here is an issue. It's very difficult having a child with ADHD, but we have the resources. We have CPT, we're doing the cognitive behavior therapy. We have a psychologist, we're doing it, but the knowledge, having the knowledge, so spreading the knowledge. I've put my number there. I'm very happy to be a resource, to have dialogue, conversations. You know, even by Zoom, you know, it's a good opportunity.
Excellent.
But I can go on and on, so I'll stop now.
And thank you.
Sinyamwa, there's something significant you said. Like even normally with children, I don't know about the United States, but in the United Kingdom, you can't give children formalized diagnosis with the exception that they are 18, because else it will be labeling. But then again, with ADHD is different, and with autism is different. Yes, so people have to be mindful of that. And also in terms of formalizing a diagnosis, there has to be Section 12 approved doctors, like doctors that they've had that specialist training, or they are psychiatry consultant, and normally they can't give a diagnosis within a day. It takes a prolonged period of time, because at times people can present with different symptoms. So over a period of time, then they can ascertain that yes, this person has this, then they will put on the person's file. So this is an additional information. Thank you.
Yeah, that's true.
Yeah. Good. Any more questions? Input?
I will give a bit of input. This is Byron here. I don't know if you guys can hear me. Where I am is classified. So I will give an input because I still work in the sector. And early this morning, I was talking to Sami about an issue, and the person concerned had dementia, but nobody knew. When they were diagnosing him, the memory clinic did not know that he used to drink a lot of alcohol. And so they didn't factor that in. And if they had factored it in, the treatment and stuff that they would have given him from the onset would have been so different. But no one knew it, and they think he just got dementia. So they gave him an ordinary dementia medication, which unfortunately, when I tried to get his GP to change, they want us to go through the memory clinic again, which is like a very long process for you to get on the ladder at the minute. So as Sami was saying, yeah, we have friends who still drink heavily, that we have to be mindful and probably advise them that drinking alcohol and becoming merry in your old age, you will be much more merrier. So we have to be very careful, because it's something that we don't take serious at all. You think, oh, alcohol will kill your cocoa and all the stuff in your body, but what I have seen with this old man with his dementia, it's terrible. We had airport where I was taking him to Ghana, and I mean, our security, he had money on him. He said nobody would touch it. They have to bring the head of Heathrow security, that we are not going anywhere until he allows us to charge the money, because even though it's money, they have to scan it. He said no. We delayed in the airport, him alone in the security section for about an hour and a half. And that's just because of the amount of vodka he was drinking after work every day. So please, we have to really enlighten people about this, especially alcohol. It's a real killer when you get old if you are not careful. Thank you.
Thank you very much. Thanks. We got hands up, but we don't have your name. Can you speak?
No, I'm driving, so I can't.
No, not you. There's another.
Infinix Hot 6.
Yeah.
Infinix, you are muted, sir. Could you unmute yourself, please?
Can you hear me?
Yes. Go ahead.
I'm unmuted. Can you hear me?
Yes.
Okay. I'm also from crack cocaine.
Pardon?
This kind of mental disorder when I was in GSTS. So as I was into drug addiction, and with my, the mental health issues was at my father's side. Both my father's siblings, some of them, you reach at a certain point, you get mental health issues, they discriminate you. You don't get support from anywhere, then you die prematurely. You understand? So some of us, when we got to realize that this was the situation, we begin to ask for help. Yes, but when I was growing up, I didn't know that there was this thing in my family. So I started with smoking a little. So it triggered it when I was in secondary school in second year. So my husband had to take me to a hospital. And at that time, they put me in an ambulance, take to Anchor for psychiatric hospital, and I came back to school. So at that time, the education became very difficult for me because of the medication and because of the stigmatization. Some people thought you can't participate with them because they see you as mentally not sound. So at times maybe you can apply for some posts, they deny you. So that depression was there from school, and it didn't end there. Even though I managed to pass my exams, my education stuff, and tertiary, it continued because I thought I don't belong to a certain class of people. Can you hear me?
Yes. You were breaking a bit, but
hello.
Yeah, we can hear you. You've been breaking.
You can hear me now.
Yes.
So that's what I was saying. And that was when they started to educate me that you shouldn't hesitate to ask for help when you genuinely need help, and you shouldn't be shy of your condition because and in Ghana everybody stigmatizes those things. You understand me? For instance, when I came from rehab, I wrote letters to the GAA alumni, and even for my friends to even encourage me, so tell the guy, oh, you can do it. I think they thought, say, oh, you call someone, they hear your voice, they cut your close friends in school. And because of me, and I could see some of them ended up in the streets. Some are in the streets, and they beg me for money. Those indicating that advocating about mental health and drug addiction issues. That, which of course, recently I had a job opportunity, but I was in a job and they called me because I've documented my stuff on both all my social media handles. They called me, I can't do that work. I've done part of it. So the stigmatization is too much to the extent that even if you have a problem and you share it to people thinking that they will support you, listen to your case, I show that they're going to help.
Yeah.
Yeah,
I think when the opportunities are not, not that much in Ghana, then you have all this discrimination, isn't it?
Hello?
Yes. Yeah. Hi. We stay here. Yes. Hi.
Yeah.
We stay here.
Can you hear me?
Yes, please.
Right. Thank you very much for the opportunity. I'm sorry. I was trying to get onto the discussion, but I've finally been able to navigate my way. My name is Felix, by the way. I'm a Ghanaian. Samuel Hanson is my very, very good friend. I went to Topridge and I went to St. Mary's. I'm saying this by way of making us aware that I'm a fully Ghanaian and I deeply understand the issues we are discussing at hand. My little contribution I will add to is this, that yes, it's a very good initiative that we have more or less commenced. For me personally, I come from the same background as Samuel Hanson. I mean, I've indulged in cannabis, never used to drink alcohol. So I know the whole, into quotation marks, I know the whole shebang about smoking cannabis and not being a part of it. You going to be seen as you're not a guy or whatever. But I believe sincerely that in order for us to actually make an impact, we ought to start from the basics. And what I mean by the basics is we ought to start from the primary schools. We ought to have teachers or tutors or people who are well educated on the issue of mental health and drugs, so they can factor that into the learning process, either on a daily basis or on a weekly basis, by way of educating them, one, about the issue of alcohol, two, about the issue of drugs, three, about the addictive nature of it, four, the impact it can have not only on your mental ability as an individual, but also the repercussions to your family. Because if you end up in hospital, somebody has to come and visit you. Somebody has to come and give you food. Somebody would have to spend money to come and buy you medication and stuff like that. So from that primary level, then the understanding may probably be kicking in up onto the secondary level, whereby, for example, Hanson made a statement that he was in one of the houses and one of the seniors came and said to him, listen, guy, you're going to have to come with me. Let's go smoke. One, for example, I'm just citing this as an example. If Hanson had been educated from his younger age before he went to secondary school, he could have been in two minds that, A, I've been told this can lead to X, Y, Z, blah, 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 blah. So I'm going to be bold enough to tell the senior that I'm not going to go, and that if you're going to punish me, you can punish me. Two, because of not having the knowledge. And three, because of, as a young person, we always think that, if you smoke weed, yeah, you're a guy, you're going to be seen as this. As a child, you always want to get yourself involved in that nature, because majority of the seniors that you're looking up to, or majority of the seniors that you admire them, who are intelligent, who are clever, who are whatever it is that you want to be like them, are more or less involved in that. So you think you also want to involve in that. It is only a few section of us who probably may have had the education by way of being educated by our parents before we come to school, or one of our senior brothers or one of our senior brothers' friend or a family friend may have been involved in something which has ended them in the hospital. And as a result of that, we have seen it firsthand, and that we may learn from it. Secondly, the genetics is also very crucial. I mean, there is, as Sam I've seen his slides, I haven't read through it, but the World Health Organization states that 1 in every 4 people that you see have a mental health issue, meaning just a few of us, even over here, 2 or 3 of us may have a mental health issue. That does not necessarily mean that it is an issue that you need medication for or whatever, because there are different types of mental health issues, i.e., for example, I'll cite depression, for example. What brings about depression? A whole lot of things brings about depression. For example, let me speak fancy. I was secondary school, I said, Charlie, will go now when yes can find touch it or yes can find and one more milk, one more gary, one more shit on the entire school, the banner say broker. That's a why dream yeah. You'll be more or less a bit like depressed. You look at yourself and ask yourself the question and say, why am I this? Why am I that? And plus, some of us too will be laughing at you. Now, school now, that itself is a trigger. Do you understand? So I'm ending my conversation here by saying that it's a very good initiative, but it, as one of the professors did say, it's a very complex issue. I have spoken to nurses who have had the opportunity to sort of like be recruited from Ghana to come and work here. And when I have had conversations with them and I've asked them, into actual mental health will harm on the mental health of Ghana or to them, she says, we learn the same thing. As a matter of fact, we even learn better than what you guys do here, because here you only specialize in mental health. But in Ghana, whilst you're a mental health nurse, you can also do general. So you basically do general and then you end up specializing in mental health. But the issue is this. The issue of rights. Patients don't have rights. Patients don't even know their rights. The staff are unprofessional, majority of them. And I heard one of the colleagues also say that a country of how much million, we only have 15 psychiatric nurses. I mean, can you imagine this? We only have Ankafo, Pantang, and Asalam Down. And if you look at the number of our brothers and sisters who have ended up or who are in the psychiatric units, and we're looking at only 15 psychiatric nurses. Not today, I will know why there. Police need to Ghana. Nurses are lucky. Nurse police police stations no do cartoons woman. Massa, you can spend about 13 years in Sawo before your case can even be called, because so it's a very, very interesting issue. It's very big, but there's nothing that doesn't have a solution to it.
Yeah.
And a journey of 1,000 miles begins with one step. So I think this is the beginning. But for me personally, if somebody's to ask me my perspective is this: or do you to me start with secondary school or primary school? Or do you to me from a school or second? I said they do secondary school or they in knowledge be about na aza ozi yo. Said to secondary school at least a wonyimzi kakra entum involved in that, because majority of us have to involve ourselves in that. Just there, o gare na o shito bintino sebi eko get to dem duwechi. Come in duwechi amasa if you get to ma'am. I'm not speaking for myself, but I'm speaking generically.
Yeah.
There's a whole dynamics, Thanks for the opportunity anyway, Sam.
Yeah, thanks.
Thank you very, very much for the opportunity. And I'm still on. If I have anything to add to, I shall do.
Yeah. Cheers, Felix. Anybody else?
Yeah, Ray.
Yes.
Kwame here. Just wanted to make an observation. This issue of personally, the few people that I know in my life that have gone off, or about them, that I witnessed in Ghana were all weed smokers, about 4 or 5 people I personally know that went off. And I've always held this in my mind that we about them. And then people with serious alcohol problems they are pretty much what we consider about them. It's about 3 or 5 people I know. Then I come to the US and almost everybody smokes weed.
Vegetable soup.
And it blew my mind away. Like, like smoking weed in the US is just so common. So I was wondering, anytime like the colleagues I work with or people I interact with, like weed is nothing. And I'm like, seriously? So there's one doctor, Dr. Bedu, one of our GSCS guys. He made this, I mean, so far, it's one person who was telling me that he thinks the problem is food. People smoke and they are not able to eat. And then that triggers that. But again, it's quite unfortunate. But my personal observation, people that I know of, I know before and after they tripped just for smoking. So for me, smoking weed, I see it as really, really, really wild thing. But I like what the medical implications and how Hanson has laid it out. But again, and as an alumni, we are thinking of how best we can help the school. At the issue of probably stepping it down to maybe primary level. I don't know how best the GSC alumni can attack that. But if we are able to, at the very least, get to the school campus and probably sensitize the kids about it, probably that's the best we can do. I yield.
Yeah. Thank you so much. Yeah. We have to do what's in our control at the moment. So I think yes, we should do it in the school and then probably conscientize others to take the info down to the primary level. But I think in the school level, I think we can do something about it.
Just a point of correction, sir. I think I am sorry, I may have misled us by saying we should go down to the primary school level, forgetting that this was an agenda for alumni only. And myself, one, I'm not an alumni, I was just a guest invited. And two, I can understand the point that it is only for the alumni, for the GSTS students. So yes, it is. And on that basis, I shall limit my submissions or my argument to, yes, dealing with the GSTS people. But perhaps in the foreseeable future, whilst you're dealing with the GSTS people, I want to know what could be by way of taking it down to the primary level. Whilst a GSTS for what I see, I hear what GSTS for no. You see, now so you've been okay. Even schools no ben GSTS around hono. Even in Kofuni able to me to one. Students na yata to one more what was there. Nanka wo pedo one we another one we but see what into no maybe 1 hour be yen release them students no one call yan fende bia Dorakwe, Chapel Hill, another any school be or Ben Hubiano. No one come on talk keke for an hour. No one sounds one brisk. Do you understand what I mean?
Yes.
It will still be under the umbrella of GSTS. GSTS full one caucus on warrior exam school will feed the beer pede on scaling down to one neighboring primary school for that because I'm coffee biana sebi on a yearly basis it been end up in GSTS and I'm a boy.
Yes.
Yep.
Yeah. Okay. Thanks. I think we get your point. So
on campus.
Yeah, I have to say,
they shouldn't form a club.
Yeah, your line is very, it's very hazy. We can't hear you properly now. So I'm not.
Can you hear me? Can you hear me now? Can you hear me now?
Now we can hear you, but when you start speaking, then it goes hazy. So I don't know whether you rather want to type some of the things you want to say and then.
Ray, I am of the view that finance horses has something significant to say. So that is why he keeps raising his hand. But then if we can't hear you properly, could you kindly scribble it? Okay, yeah.
Can you hear me?
Yes, we can hear.
Yes, what I want to say is, when I was in GSTS, there was a time I was caught with about 10 rows on campus, which belonged to a senior. And they called me, gave me to a counselor, I made them know that I'm drugs. But the counselor would be like maybe one day talk. You understand? The person already check up on whether the guy is doing well or not. So if it should be possible, they have to have an office, or if possible, they should make a club. They have the wildlife club. I think they have so many clubs. They have Gunsa. They have to have maybe that rapport, or maybe talk to the person. Let know this is what this guy is going through. Try to help the person out. Please, do you understand me? And if possible, you should have an office on the campus, basically on drug addiction, so that even other schools can even bring schools over here because of that. Please, can you hear me?
Yes. But I think, well, I can't answer for the school, but I think that it's going to fall under the counseling bit. So we have to just let the headmaster, we need to speak to the headmaster to keep an eye on this drug abuse bit. But can I say that Tata Abekwe is also here, so maybe because we can't hear you properly, because maybe we have to take this offline because we can't hear you properly. And I think what you are saying is that there is some sort of stigma if if you are caught holding some roles, then your teachers deal with you, but they also have to be educated.
Can I make a suggestion? Please?
Yeah, I think we really have to take this offline and then speak to you, because we can't hear exactly what you're saying.
Can you hear me?
No, not you. I'm talking about Infonet.
Right.
Infinite. Hello, Ray. Infinite Hot says, I believe that you have a very solid point that probably you want us to know. So you email to the facilitator, Raymond Akwaku, then we will engage you. Is that okay?
See, and at times I get surprised.
Okay. Now this is your side. We need to hear the other side. So leave it with Giant Abekwe. I think he would, or we will pick it up. We will pick it up. All right. Okay. So don't worry. Okay. But send me your number as well, because I think it's something that is very crucial. But please remember that the teachers have the responsibility, of care for the kids while they are in school. So, I mean, Jans, we are outside. We can come and talk, or you can also go and give a speech. But 3-hour speech, what can it do? So I think
that's why I said they have to form a club. They have to form a club on campus. As they have the SU club, the wildlife club, and the rest. They have to form a drug addiction club. Where when they see students in that situation, they'll go to the aid of the students.
Meeting can officially end. Thanks.
Okay. Thank you very much.
Ray, can I make a suggestion before? Can I make a suggestion?
Yeah, can you make it very swift? Very, very, very short. Please.
I will make it very, very swift. But the suggestion I was about to make was this. You made mention about teachers having a responsibility for the children who come into the school. That's 100% right. One of my suggestions was this, that anybody who comes to GSTS or anybody who enrolls in a school obviously has a prospectus. So if it's possible, why don't the Giants make it such that GSTS smoke free school into answer never be GSTS no awofo or there etumemo bani ya where there ebe GSTS XYZ. Our teachers no so now we get a responsibility no so no. I want to know the onus has to be on them, that your responsibility is to ensure that there are no drugs, because for all you know, or for all you care to know, the teachers themselves smoke. So one of the suggestions would be to even screen the teachers themselves even in school before they even come to teach. And just to hit on Kwame Nana's seminar, there, when they were trying to help the guy wanted to get compensation from what's it called? The Giant, because the Giant has come together to want to help a situation which is very bad. Really and truly and honestly speaking, Siakapa na nkasa ayen giant yetu ma aja atum de ada padior ken or no currently yabua na padni betum we sue school directly. Not now, but I'm just as our afterthought. You understand what I'm saying? Because it is out of the GSTS school. That is why he's had this trauma, and that his colleagues are helping him. Now, if the teachers were able to support, if the teachers were able to take their responsibility seriously, or if there was a mechanism where this guy could have gone to report these issues, I guess, some of these things can be curtailed. So in as much as it's very, it's very complex, we can deal with it by putting certain measures in place. Yeah. But I commend you guys. You guys are doing a very great job, and it's a very, very great initiative you've taken on board. I mean, you come across some serious hurdles, but I would also indulge you guys or crave your indulgence and say there, Charlie, serious measures must be put in place. GSTS yen rules ni yet show the kite rule and yet show the kite tampia ebia last warning and I sako. I also teach na year for no. And GSTS in alumni for no sum to me undercover investigation to investigate one and all about the school.
Yeah. Felix, brief here. Maybe. Okay, me that's it.
It's interesting. Yeah.
Okay. I think we have exhausted the time. Hot 6. Give me a call and let's take it from there. All right.
But then please send me your number, please.
Yeah, I'll send you my number.
Because as a giant, if I tell you what I'm going through because of drugs after rehab, how I'm coping now, you will be surprised. It's a Rambo style here. It's a Rambo style.
It's a Rambo style, but anymore, when you are professionals. Inti oye awo na oye de edu nisi phone nenya reshimi there. Your brothers who have come together will be able to support you and help you.
Okay, then thanks.
Yeah. Them I reshimi no. Nya wan kote na akọ true them nzeme yo. But I reshima me pede enyanye there. I will beat the Kwame Ray, Hanson, and these are people who are professionals in their own right, and we winning Zeno. But hurdles be, but I say it can be done.
Yeah, man. Okay.
Yeah, it can be done.
Yeah, I think we've had a lively meeting. I just want to thank Giant Hanson for giving this brilliant talk. We have to come back to version 2 sometime next year. So yeah, prepare for it. And all those from Ghana, from the US, and here as well, thank you so much. I mean, we can still stay on, but officially we have finished this meeting. Thank you so much.
And also a big thank you to Ray and Professor Kwamina himself and Dr. Abakwe and Dr. Ofori and everyone who contributed. Thank you very much. And it's nice to see faces as well.
And Sonic, nice one. Very impressive.
Thank you.